Matthew Holt, is it the luck of the Irish? Put down your green beer. We've got green money flowing in from everywhere. It's the March 17th episode of Health in 2.00.
So Jessica, I know it is St. Patrick's Day. Do you think some of the people have been in the investment community have been at the green beer a little bit too early?
I've never seen such a crazy one. Forget Aaron, go bra. Aaron, go get your checkbook.
Aaron, go what? What's the Irish thing to say?
Aaron, go bra.
Aaron, go bra?
You've never heard that before?
It's you people from Chicago. You've been dyeing the river green. It's been affecting your brains. I don't know what you're talking about.
I'm the most Irish Italian person you'll ever meet.
That is true. Yeah, but I did see them dyeing the river green in Chicago again. As they said in the Fugitive, if they can dye the river green one day of the year, can they dye it blue the other 364 days? All right. Was indeed a crazy, crazy funny day. We're not going to get to all that, but why don't we give it a go?
Let's give it a go. Yeah. Let me see that timer. Are we going?
We're going.
Oh, the news we've been waiting for. As soon as that timer starts, Doctor on Demand and Grand Rounds merge. What do you think?
Whoa! So this is a big one. I mean, so that what can we say? Owen Tripp and Hill Ferguson finally got it together. Finally got the green beer. I don't know how they decided that they wanted to do this. It's interesting. A, no SPAC. B, both big investments from Venrock. So I don't know if Roberts and Kocher were together, wanting their 10% for the merger deal. And then, the really interesting thing is that Grand Rounds has been extending out from doing just second opinions to doing everything, all kinds of navigation. At some point, it said it wanted to add telehealth. Doctor on Demand obviously started with acute care telehealth, doing more and more chronic care management, doing some virtual only telehealth, virtual only primary care. It kind of makes sense. As that whole thing globs together, we're going to do primary care and navigation, all the rest of it. It kind of makes sense to have it all together. It's a $2 billion plus deal. They both added around $1 billion the last round. A lot of money, a lot of funds in there. Two great companies. We shall see, but I think this one is a real harbinger for the future. Just no SPAC. Who knows?
Love it. All right. What about Strive? They get $140 million. This is Google money. Their total $217 million. What does this do?
This is one of those, and none of them Cricket Health, CBS is one of, this is like, let's reinvent chronic kidney disease care. Let's try and figure out who's going to get it badly early, intervene early. There's a bunch of companies doing this. It's a big market because we spend a lot of money on kidney disease.
All right, social determinants of health startup Unitas gets $150 million, bringing their total to $195.5. Crazy amount of money. Crazy
amount of money for them, because what they're basically doing is integrating social determinants of health, social services agencies into medical records so that providers can refer out to them. They've done very well, got Kaiser, a bunch of other people in play. So, love the company.
All right, what about Clarify Health Solutions? They get $115 million. This is another one, $178 million total. These numbers are staggering.
It is quite a day. And by the way, there are a couple we haven't got to.
I know. We've left hundreds of millions on the table for tomorrow.
Right, which we'll talk about tomorrow.
The hangover episode.
The hangover episode where if you only raised $78 million, you barely count, right? Okay, but Clarify is one of the number of companies, Komodo Health's another one. They're basically doing massive population health data, then taking it primarily to drug companies to say, okay, we can figure out which doctor is prescribing which drug to what kind of people, what can we do to help you bump that up, but also taking it to hospitals and saying, okay, we can figure out which of your, in the ACO world, which of your people is referring out of the network and into the network, and can we fix that? And also taking it to health plans and saying, how can we figure out your overall spend? So this kind of new data play, there are a whole bunch of people with different flavors of which population health data they're doing. I mentioned it, Komodo, there are a bunch of others as well, who are really, helping to sort of get to the next level of data analytics. Whether any of it makes any difference for healthcare savings remains to be seen, but we certainly know a lot more than we did, and it's interesting. But yeah, that again is a big number, given the amount of different companies that are doing the same sort of thing.
I can't believe it. You left me back at the Doctor on Demand Grand Rounds. Oh, did you hear Brian Dolan? I have to shout out Brian Dolan for his clever naming of the new combined entity. It is going to be Grand on Demand. I think that is going to be. I love it.
It could be Grand on Demand.
Grand on Demand. If you're Matthew Holt with an accent.
But I mean, it's interesting because they've both been hanging out a while, right? They've both been. I mean, so you did see the Accolade, which is, in a different flavor of the navigation way that Grand Rounds went public. They acquired Second MD, which was a second opinion service, which is where Grand Rounds started. Doctor on Demand obviously has been in the top echelon of those telehealth companies, but it has never got to Teladoc or even Amwell level. So they both need a kind of new idea. And as I said, that whole thing is kind of splurging together. But who's going to be the front door, and who's going to be the first person you go to, and where are they going to route you around the healthcare system? So I think that's interesting. I would suspect that this big merger, there's no SPAC. There's probably another conversation we haven't heard about where some big health plan decides it wants them on board. You've got to imagine that Optum is sniffing around here.
Didn't Grand Rounds have that big deal with Walmart for a long time?
Yeah, I mean, but that was something for their employees. But didn't they also? I think they were talking about working with their medical groups as well. I don't remember. But the point is,
I was gonna start a rumor.
the point is, right? Telehealth, remote patient monitoring. There were 2 remote patient monitoring deals, which we'll have to talk about tomorrow, right? Remote patient monitoring, mental health, which will be a mental health deal tomorrow, primary care, and navigation somewhere in the middle. I mean, that's kind of the new entry. And then we didn't mention bots, but there are all the bots around, which, help that person. You can kind of see, we need to do a show on this, but you can kind of see where that all starts filtering together. And, a person who has some level of chronic disease needs to be managing that whole thing. And there's obviously the sides are being chosen in the pickup basketball game. The multiplayer.
I kind of feel better. Don't you feel? Maybe you don't, but I feel like a little bit at peace now that I know where Doctor on Demand has gone, because I feel like that's been like the big outstanding question mark. I do. I mean, where's it gonna go? What are they gonna do?
So now Teladoc, Amwell, MD Live, and Dr. Demand have all got a deal. You're feeling better, and you can.
Everybody's in their place, and I feel better. Now let's do some M&A.
Your OCD is showing through.
I was just going to say, but now let's do some M&A with mental health companies. Like, who can I pair up? Like, Matthew Holt, this goes back to me being a romantic. I just love to see good partnerships. Oh God, people, if I were you, now would be the time. If you have been reluctant up until this point, I would go and sign up for our email newsletter on thehealthcareblog.com, or go to YouTube and bypass that junk and just subscribe to the Health in 2.0 YouTube channel so you do not miss an episode, because things have gotten nuts and we are here. Nuts.
All right.
That nut is at Bolty Boy. I am at Jess Tomasa. We will talk to you guys tomorrow, the day after St. Patrick's Day episode, when everybody remembers that they're not Irish.
And is suffering with a hangover.
Exactly.
Well, probably not.
Hopefully not these funding hangovers. We'll talk to you guys soon. Bye.